What I want to talk to you about this morning is complementary health approaches. What are complementary health approaches? Well, it's exactly what you think it is. They are approaches that will complement your health. So, patients who tell their providers about their use of complementary health practices, they can better stay in control and more effectively manage their health. When providers ask their patients, they can ensure that they are fully informed and can help patients make wise healthcare decisions. 4 tips, guys. Here's 4 tips to help you and your healthcare provider start talking, okay? List the complementary health practices you use on your patient history form. Let's pump the brakes right there. Let's define complementary health practices. Complementary health practices are things like supplements, things you do to help complement your health. Take a moment and think about what you do every day or weekly, maybe monthly, that complements your health. Things like class, the graduates program in Balance University. This class would be considered as a complementary health practice. Going and getting a massage, continuing to walk every day, right? I tell you guys all the time how important walking is. That is considered a load-bearing exercise. It strengthens not only your muscles, but your bones as well, okay? And as we age, we know we become more susceptible to osteoporosis and osteopenia, especially our ladies, okay? Tip number 1, we talked about list your complementary health practices on a patient history form. Number 2, each visit, be sure to tell your provider about what complementary health approaches you're using. Don't hesitate to talk to your doctor, guys. I would even suggest at least once a year, you go through your medications with your physician. Now, I know it is a challenge for a lot of us to get our doctor, our physician, especially our GP, our general practitioner, to stop for 10 or 15 minutes and have a conversation. There are some doctors that are better than others, all right? I have friends. My wife works in an office where they have a surgeon who sees 4 patients every 15 minutes, and he is busy, all right? Then she also works with a fella that will see 1 patient every 15 to 30 minutes. Those are long days. But he makes himself available, right? We should all be so lucky to find a physician like that, okay? Tip number 3, if you're considering a new complementary health practice, ask questions. Ask healthcare providers about safety, effectiveness, possible interactions with medications. That's a big one, guys. Most of us are taking multiple medications. We call that polypharmacy. So you want to make sure, especially when it comes to balance, are there any medications you're taking that directly or indirectly impact your balance, right? Don't wait, tip number 4, don't wait for your providers to ask you about any complementary health practice you are using. Be proactive, start the conversation. All right, so that's from the National Center of Complementary and Integrative Health. That's a National Institute of Health branch. That will be on the website this evening, probably tomorrow. That'll be on the website tomorrow. So you can pull that page, you can go through it. My sources and references are always posted, all right? So I wanted to discuss that because I want to encourage you guys to be your own advocate, okay? If you need a second opinion, don't hesitate, all right? I want to empower you. I want you to go out there and take charge of your health. You guys obviously are on the right track because you're here this morning. Big smiles. Everyone's looking so good. I always get the best looking classes. I don't know how that happens, but my classes are always the best looking group of people. Unbelievable. Any questions? Nope. All right, let's rock and roll. Let's have you stand. We'll go behind our chairs.